It's a scandal that infectious diseases continue to ravage populations across the world, including children, that mothers continue to die from childbirth, or that children die from preventable causes across the world. And that's why in 2000, when the world agreed Global Development Goals, 3 of the 8 goals were about improving health. Healthcare was a top global political priority, and these goals spurred great progress. But despite this, they were not achieved, and global initiatives have not delivered strong healthcare systems overall. As the target date for these goals came closer, a new set of global goals were negotiated, this time much more universal and broader in scope. Universal health coverage, that's healthcare available for all, is now the important target, rather than individual types or causes of ill health. For the EU to support this new transformative agenda, it's important to look back over the Millennium Development Goals to learn what lessons they can provide. Save the Children has taken time to undertake such a reflection for health, researching what experts in the field thought about EU health support, as well as examining the finance the EU provided to health as part of its aid budget. When health rose up as Europe's political agenda for development, more funds were provided, but this was spasmodic, and overall the levels provided were extremely low. We have found that EU support to health has been lacking. Lacking in the amount that it has been predictable, but also lacking in how much it represents of the overall EU aid budget. The research highlighted how development assistance for health must have a higher priority if healthcare for all is to be a reality, and that support to health in middle-income countries must continue in some form. The fragmentation of healthcare, in part caused by the way support to health has been provided, must now be avoided. Budget support directly financing developing country budgets should therefore also be prioritised. And support should be provided beyond finance, with EU policies across the board more aligned to the EU's development goals. Towards the end of the Health Millennium Development Goals, the world had a bold warning about the dangers of not having strong healthcare services available to all. The Ebola outbreak served as a warning on the need to ensure healthcare systems are both universal and strong in our interconnected and globalised world. Unfortunately, this lesson doesn't seem to have been well learned. Support to health systems has faded from political agendas as the Ebola outbreak faded. As the EU discusses a new consensus for development, it needs to recall the fact that poverty alleviation is at the heart of EU development cooperation, and that if poverty is to be effectively tackled, then all people must be provided with the healthcare systems necessary to keep them alive, healthy and productive. This requires the EU to give health the priority its importance requires in its revised Consensus for Development. Much more detailed recommendations are available in our report, and you can find a link to that report if you click just here. You can also share and like this video to make sure more people are aware of these important findings.